Greetings, gentlemen. Roger Bowman here on behalf of Masculine Wellness. The topic of this video here is going to revolve around a question that I recently received, and to be honest, it's actually a very common question that I get and answer pretty much on a weekly basis. So I'll dive right into it. I'll just read this. It's actually a couple of questions, but it revolves around the same topic. It says, "Hi, Roger. Thank you for your openness on this subject." And this is pertaining to me discussing testosterone creams and TRT in general. What did your numbers start with, and how long did it take to get you up to 1500? And that's referencing to my personal labs that I shared on a video over at Roger Bowman's Wellness and Fitness Coaching channel. Will using this, as in testosterone TRT, will using this interfere with your body's ability to produce testosterone on its own? And are you ever able to stop using it? Thank you so much. Well, thank you for the question. And once again, because it is so common, I've just felt the need to jump in here and answer it for everybody else. So the short answer is, as most of the time it depends, but I will say in most cases, if you are to start and then stop testosterone therapy after some time, your body will in fact bounce back. This is under the assumption that you do things correctly while you are on a testosterone replacement program. During a testosterone replacement program, whether it be administering the testosterone via injections or applying cream each day, you really should incorporate some HCG if in fact maintaining Leydig cell function in the testicles is of importance to you. So another question guys often ask is, will I be, or will I still be fertile? Most likely you will not be too fertile while on testosterone replacement therapy if there's any fertility going on there at all. However, and this is the honest truth, I have seen a couple, not many, a couple of cases through the many years where a pregnancy did occur, but it's extremely rare. You're most likely not going to be fertile. Your LH, FSH signals essentially communicating from your brain down your testicles are going to slow down dramatically, if not completely shut off, depending on what you are doing and how you're approaching your TRT program. So, how long did it take me to get up to 1500 on my labs? Which, by the way, for most guys is a little bit too high, especially if there are other concerns with cholesterol, polycythemia, and others. For me, fortunately, I am able to maintain very healthy parameters, lab parameters, with my markers pertaining to overall health. The only question mark I do have, or concern, in other words, I do tend to have, is I do have some pretty big increases in red blood cell and hematocrit counts, but I simply just go donate blood to American Red Cross every few months, which I honestly like to do because I'm helping to save lives anyway. So that concern is kind of nipped in the butt, and therefore I can maintain fairly high testosterone levels, and other parameters such as estrogen and others tend to stay pretty nice. So how long does it take me to get to 1500? Pretty much right away. Another way to preface that question, which I suspect is where the question might be coming from, is how long is it going to take me to feel the effects of testosterone? Or maybe how long is it going to take me to feel good, look better, and so on and so forth. I believe that is the question that lies behind the question of how long did it take you to get to 1500. And again, this is just me speaking from experience. And once again, the answer to that question is it really just depends. There are stages and phases when one starts a testosterone replacement therapy program. Typically within the first couple of weeks, we just have an increase of cognitive function, or cognitive abilities, a clarity of thinking, if you will. Our body starts to utilize glucose better and partition nutrients slightly better. It's all a process. So it's essentially like jumping in a really nice jet, and then you start flipping on the switches initially when it's on the runway. It's like you don't just put a pilot like the testosterone in the cockpit and then you're up in the air. It's like there's a process, right? You guys start flipping on all the switches. Engine 1 fires up, engine 2 fires up. The wings open up, and then you start getting, you got to get on the runway, and then you got to start going. Then you start getting airborne, and then you're off, and you're propelling through the air, and you're flying high, right? So it's a process, just like when you start testosterone replacement therapy, it is a process. But again, your serum testosterone levels, circulating testosterone levels, whether you are approaching things with injections or creams, they should go up right away. It's just the effects are often delayed depending on the person. So yes, and back to the other question is, can you stop using it? Yes, you would be smart to, once again, utilize HCG. And then if you do have to stop because maybe you and your wife decide that you want to become as fertile as possible because you want to have babies, or maybe unfortunately you've ran into a financial situation where you can no longer afford TRT and you need to come off, you would be smart to incorporate maybe some clomiphene, some type of AI aromatase inhibitor. And then clomiphene is a key ingredient that has been used very successfully by many, many men coming off of testosterone replacement therapy programs. So essentially those three ingredients, if you will really kickstart the body's HPT axis, which is hypothalamus pituitary testicular axis. Okay, so it's essentially like a feedback loop. So the brain communicates to the Leydig cells down the testicles, and then there's a negative feedback loop that goes back to the brain. I've spoke of this in previous videos. It's essentially like thinking of a thermostat on a wall communicating to the furnace, which is like our testicles, heating things up and kind of therefore putting out testosterone. You have this axis system, right? So you are essentially jump starting that with those ingredients. So that for most men, again, works very, very well. So in short, yes, if you do things correctly and you do things in a smart and responsible way, yes, you can absolutely come off testosterone and be fine. Now, please know that your testosterone levels are not going to be nowhere near like they would be or what they are when you're on TRT. And, depending on how long you have been on a testosterone replacement therapy program, you may not have the testosterone levels that you once had prior to starting your TRT program. So, for example, for me, I have been on TRT for almost 8 years. So if I were to stop testosterone replacement therapy right now, I would not have the same level of testosterone that I had, 7, 8 years ago. I've aged. My glands have aged. My testicles have aged. Everything is aged. So you have to be realistic about what things are going to look like if and when you do stop TRT as well. So hopefully that gave some insights. I know it's probably a bit more thorough than maybe what I needed to be. But as always, just trying to help you guys out and give some insights here. So hope that helped. And other than that, please feel free to click the subscribe or follow button and stay tuned for more insights and reviews and all that good stuff. Everything as it revolves around men, masculine wellness, and our health so we can look and feel our best. Thanks again for checking in, guys. I'll talk to you in the next video.